Good evening. Thank you for joining us this evening at the 4th Health Votes Montana Candidate Forum in Missoula. My name is Stacey Anderson. I'm the Policy Director for the Montana Primary Care Association, which is the association that represents community health centers across the state, including Partnership Health Center here in Missoula. So thank you again for joining us. Thank you for the candidates for taking time off the doors and the phones and fundraising to join us. We really like and appreciate your time answering a lot of questions on health, because it really does impact everyone in Montana and everyone who's sitting in the audience and hopefully listening over the airwaves. So what is Health Votes Montana? It is a coalition of nonpartisan, nonprofit organizations that are really committed to providing an opportunity for communities to hear what their candidates believe and think on a variety of healthcare issues. As mentioned, we're nonpartisan. None of the organizations represented tonight do any candidate endorsements, and the variety of issues really span from birth to death. So that is why we want to be here. Tonight's sponsors, in addition to the Primary Care Association, are the American Cancer Society Cancer Action Network of Montana and also AARP of Montana. So tonight we have a great moderator. We want to thank her for joining us. Her name is Amy Casio. She is the founder of Studio Verde Creative, a full-service creative agency. In January 2015, she was diagnosed with invasive ductal carcinoma, that's a form of breast cancer, when she was 38 years old. As an entrepreneur with a lifelong pre-existing condition, she has affordable, quality health care because of the Affordable Care Act. She is a legislative ambassador for ACS CAN and is a passionate advocate for cancer survivors, as well as for ensuring access to affordable, quality health care. Thank you, Amy.
Thank you so much, Stacey. And thank you, candidates, for being here. We really appreciate you taking the time not only to answer the questions that have been prepared, but also to hear from audience members with some questions, additional questions as well. So I'd like to explain the format and the rules of this panel. As Stacey mentioned, we're a nonpartisan educational forum, and really we're here to educate all of us about questions that are of concern. So why we're here is because we all benefit when there's conversations about issues that are important both to audience members and to candidates. So what I'd like to do is let you know that we are asking each candidate running for the same seat the same questions. We'd like to rotate who answers those questions. So I will do my best to keep track. What I'd like you to do is if I miss someone, just answer in the next order. So each candidate will be given up to 30 seconds to introduce yourself. And what I'd like you to do first is to state your name, the location of your district, and a public office you've held, and any kind of community involvement that you've had here in Missoula. That's for the introduction. For the questions, each candidate will have up to 90 seconds to answer. We will remind you that if you agree with something that has been previously stated, please just say that you agree with the candidate that shared that response, and only add something if you have something substantive to add. That way we can get to more questions. Some of the questions are lengthy, and what we will do is we will read the full question once, and then, rather than having to repeat the question back, please just feel free to refer to the number of the question moving forward. That'll keep us moving forward. We have a timekeeper in the front row. This will remind all candidates and the moderator when the candidate has 30 seconds left, 15 seconds left, and then when time is over. We will also allow about 15 to 20 minutes from questions from the audience. And to audience members, we welcome all health-related questions. We ask you to ask questions that are every candidate can answer. As soon as that last question is asked, we'll transition to questions from the audience. And we just ask you to hold applause until the very end. And I think that covers all of our rules for the moderation. Does anyone have any questions? Great, so what I'd like you to do is, starting from left to right, just go through in order and introduce yourself, the office that you're running for, and a little bit about community service here in Missoula and your most memorable campaign moments so far.
You can't do that in 30 seconds. So, I'm Diane Sands. I currently represent Senate District 49, which is 500 square miles, primarily the western edge of Missoula County. It includes Orchard Homes, Target Range, Elmar, Lolo, all the way to Idaho. So it's a big district, a lot to cover. Some of these people have nice compact city districts. I don't. I was first elected in '97, serving some urban counties, communities in the middle of Missoula. I've served in the House for 4 sessions, total of 8 years, and then was elected to the Senate, and I'm finishing my first term and running for my second. Thank you.
Hi, my name is Nikki Sardo, and my district is Senate District 50, and it is the slant streets. It goes up Miller Creek, lower Linda Vista, and it kind of makes a zigzag all over the place. There's 19,000 people, 10,000 houses to knock, and so far I've done about 500. My community service, I'm state committee woman for the Republican Party right now. I've been for 3 years now. Stop. Jeez.
Good evening, everyone. My name is Bryce Bennett, also running for Senate District 50, the boundaries of which Nikki just described for you. I've served 8 years in the legislature in the Montana House of Representatives, and am now running for a seat in the Montana Senate. You know, in my day job, I do a lot of work to educate and empower the next generation of young leaders. And in the legislature, I'm proud to say that I've done a lot of work to make sure that healthcare is affordable, accessible, and making sure that people in need are getting the healthcare they so deserve.
Sorry. Hi there, my name is Katie Sullivan. I'm a candidate for House District 89. 89 includes the University neighborhood and extends all the way out through Clinton and Tura area. It also extends down to get a little bit of Florence, as well as the Patty Canyon area and Upper Miller Creek. Let's see, public involvement. I've been on the University District Neighborhood Council for the past 4 years, and I'm also serving on the board of the Poverello Center. And I'm a first-time candidate.
My name's Marilyn Marler. I am a first-time candidate for House District 90, which is generally the South Hills and parts of Lewis and Clark neighborhood. I served 12 years, which is 3 terms on the Missoula City Council, including serving as the Missoula City Council president. I have been involved in a lot of local boards in Missoula, mostly having to do with science, nature education, and the environment. My husband is also really active in volunteer service in Missoula.
Hello, everyone. I'm Connie Keogh, and I'm running for House District 91, which we are currently sitting in. It goes all the way up the Rattlesnake and over to University Avenue. This is my first time running for office, and my public service, my work in the community has been around conservation issues, mostly Montana Conservation Voters, Northern Plains Resource Council, and my day job is changing people's lives. I've been an educator for my entire life and believe in the power of education.
Good.
Good evening. My name is Patrick Maloney. I'm in House District 97, which is the Lolo area. Lolo, Big Flat, Elmar, all the way out to the border, just like Diane in District 49. I am a stay-at-home father for the last 14 years. This is my first year running as a candidate, and I have been a council member for the Lolo Community Council for the last 3 years. So this has been a passion of mine, and that's why I'm here.
Thank you, Patrick.
My name's Kimberly Dudick. I'm currently the representative for House District 94, which is the north side, Butler Creek, Grant Creek, Huson, Evero, and Frenchtown areas. My background is I'm an attorney, but before that I was a registered nurse. I specialized in neonatal intensive care. I now serve on the board of St. Patrick's Hospital here in town, and I focus a lot of my policy work in the legislature on making sure people have access to affordable and accessible health care, but also on decreasing substance abuse and helping with mental health disorders.
Guess you have to improvise every once in a while. Shane Morjo, I represent House District 95. I grew up in Ronan, Montana. Lived in Montana my entire life. I love it here. I was elected to the legislature last session. Before that, I worked 2 sessions as a lobbyist, working on expanding Medicaid so that all Montanans can afford health care. Last session, I served on the Judiciary Committee where we heard a lot of issues in regards to social justice. I was a minority whip, currently still am, and I look forward to talking more with you all tonight.
I think we got a mic. We don't? Can you hear me? Oh, there you go. I'm sorry. Can you tell I'm a first-time candidate? Tom Winter, running for House District 96. That's west of Reserve, south of 90. North of Mullen, all the way out to kind of the 9 Mile area. What have I done for community-wise? I have been part of a team that welcomes some of the newest Missoulians and newest Americans to our community through Soft Landing and the International Rescue Council. They were refugees. That's been a passion of mine, and the reason that got me to run, I can tell you right now, and we're going to talk about a lot of it tonight, is Medicaid expansion and what it means to the state of Montana and how important it is that it continues beyond 2019.
My name is Jim Sadler. I'm candidate in House District 98, Target Range and Orchard Homes. I was elected for 21 years for the Missoula County Public Schools as a trustee. I served on the city council way back before many of you were born. I'm active with the Missoula County Fair and on Fort Missoula, and with the Memorial Rose Garden, we're redoing that.
Good evening. I'm Representative Willis Curdy. I represent House District 98, Target Range, Orchard Homes, Fort Missoula, and the South Reserve Street corridor. I've been engaged in Missoula for some time. I taught high school here for 30 years. I was on the Missoula Rural Fire District Board of Trustees, and I served as on a water district as a commissioner. I'm one of probably 4 folks in this room right now who voted for Medicaid expansion in 2015, and I'm proud of that.
Hi, good evening. My name is Marilyn Ryan, and I represent House District 99. 99 runs from Russell West, Lower South Hills, Lower Linda Vista, back down Lower Miller Creek, goes all the way back behind the mall, and is adjacent to Willis's district and back to Russell. I'm in my first term, running for a second term. I'm a former educator, retired educator. In fact, for a brief time, Willis and I worked together. I taught middle school and high school. What have I served on? Most recently, I was on the Missoula Education Foundation. I served previously on the United Way and Muscan Gully Council.
Wonderful. Thank you all. Now, as you can see, we have a robust number of participants, so that is fantastic. Rather, though, than have every single person answer the same question, we're going to divide you into 2 groups, and that will allow us to hear more of these questions. So what I'd like to do is have, we'll go from Senator Sands to candidate Keogh as Group A. Group B will be Patrick Maloney through Representative Marilyn Ryan. The first question is number 1, and it is, health is more than what happens in the doctor's office. Lack of access to healthy foods and affordable housing have a tremendous impact on health. What policies and long-term solutions do you support that address these social determinants of health? The second part is, would you support innovative solutions such as a retailer incentive to enable discounts for people using Supplemental Nutrition Assistance Program, or SNAP, benefits to purchase fruits and vegetables? So the first person to answer will be Senator Sands.
Thank you. I've served most of my legislative career on health and human services. It's a priority for me. I've often chaired the interim committee. I come out of 50 years of work in Missoula, and much of it has been in healthcare. I helped start Partnership Health Center. I worked for the health department. I worked a little bit for the Missoula Indian Center. So issues of public health, to me, are the primary way we get ahead of some of these issues in terms of prevention. It's not just that we need additional income, it's we need to really focus on prevention and early intervention for many of the problems we have in our community. But I got to say is reality. You can talk about innovative solutions, but the reality is this next session is going to be about one major thing, which is making sure that we can reauthorize expanded Medicaid for approximately 100,000 people. And in addition to that, around food stamps, last session it was my pride and joy to make sure that I killed Senator Fred Thomas's bill that would have taken 11,000 kids off of food stamps, hungry kids not getting food stamps. Those are the realities of things we deal with. You can talk about innovative new programs, but defending what we've got is a huge part of it. In terms of prevention, there are many things we can do relative to that are population-based. Healthy food is certainly one of it. Clean water is an issue across the state in certain segments. But access to primary health care so that you can actually a kid can see a dentist. People who have mental health needs can actually get treatment. And funding for treatment programs for mental health and substance abuse is a #1 priority in the next session, and I work on those issues as a primary concern.
Nikki Sardo. As far as the first part of the question, I don't have an answer for that, but the second part, because I come from a business background, I've been in business for over 40 years, different businesses, I think that the retailers could get tax incentives by selling foods at a discount to people that are on food stamps. Yes.
Bryce Bennett again for Senate District 50. I won't belabor by saying that I agree with a lot of things that Senator Sands said. I mean, it is so much about access. It's so much about ensuring that people can get the care that they need and the support that they need for all the different programs. Because as much as I've listened to different people around the district and as much as I've listened to folks that are physicians, they tell us about the importance of treating the whole person. Because I think this question starts with the right premise that, it's not just about what you do in the doctor's office, but it's making sure that you have access to healthy foods, access to affordable housing, making sure that we're not pricing people out of their housing, making sure that rentals aren't getting higher and higher, because if you don't have a roof over your head, you're going to end up in a medical situation in a very short amount of time. So we got to make sure that we have full coverage for people, that make sure that they can get to the doctor's office when they need to, that they have healthy foods, and certainly I do support the discounts that would come from the SNAP program, and certainly trying to make sure that housing is affordable and accessible for folks. And I think that all those things together will make sure that Montanans are healthy and happy.
Thank you. Katie Sullivan here. I would like to start by saying that I agree with Senator Sands and Representative Bennett. I am a supporter of the SNAP program, and I support retailer incentives, and I'd be happy to look at other innovative solutions that anyone has that would help expand the program and maintain it. As an older millennial, I would also like to add the idea in the future, now that online ordering has become more common and accessible, possibly integrating that in some way so that rural communities and the physically disabled persons could have a possible delivery and online ordering, and that could be a great way to push healthier options via a website as well. So something to consider in the future.
I agree also with a lot of the things that have already been said. What I'll add to that, in addition to we have to protect SNAP, we have to protect Medicaid expansion. I have a lot of experience that I can bring on some of the effects of the budget cuts at the federal level and the state level and local government. For example, the city of Missoula used to get we used to get more federal grants for local issues, including some that could be used for food security. There was a program with a nonprofit in town that had been funded by federal grant funds that would double SNAP dollars through one of the local agricultural nonprofit, and the city of Missoula was simply not able to fund that program anymore, and it was heartbreaking because it was a local innovative program to get healthy food to low-income people, and the money just disappeared. So there's not much we can do if everything is cut. Another thing that I think I could represent from Missoula to the state government is the role of civic planning for health and wellness. We need to have access. We need to have transportation systems that include biking, walking, public places to get together like parks, and that has to involve nonprofits, neighborhoods, and city government. I'm getting the stop sign, and I forgot my last point. Fund mental health. I'll stop with that.
Oh, this is a hard group to follow. I echo everything down the table here. You know, it is hard to come up with long-term solutions to address some of these issues. But I do feel, as a legislator, it's our obligation to keep working towards solutions. Fully funding the SNAP program, getting access to affordable foods, whole foods, and then doing things like Garden City Harvest does, where they're helping people understand how to eat healthy and how to cook and store the food and that sort of thing. So encouraging participation in preventative programs, there's so much that we could do. I just want you all to know that it's a passion of mine to make sure that we support preventative programs, and I just believe it's an obligation of all of us to do that. Thank you.
So what we'll do is we will start with the second question and begin with candidate Maloney and move through to Representative Ryan. The second question is, most Montanans want to stay in their homes and communities as they age, even when health challenges occur. People who qualify for Medicaid are entitled to nursing home care, but the Medicaid program that provides care in a home or in assisted living residence is limited and has a long waiting list. Given the high cost of nursing home care and the lower average costs of care in homes or assisted living, how will you expand seniors' opportunity for services in their homes and communities?
Well, that's a good question. Let me start by saying that when a person gets to the age where they need Medicaid, Medicare, and they need the hospice kind of care, it's important that we remember that they are first and foremost human beings, and providing them care means we need to provide them with physicians, we need to provide them with nursing staff. And right now, the biggest problem that we face across the country, not just in the state, but across the country, is nursing shortages. So to answer the question, I would first and foremost really work on trying to get more nursing staff built up in this state, because the more we have, the easier it's going to be able to provide those services under the auspices of the Medicaid and Medicare system that we currently have. So for me, that would be my priority one, would be to staff more nurses, more physicians in positions where they would be able to take care of that. And secondly, I would like to actually touch on the SNAP issue real quick. One of the things that I would do for the seniors and that want to stay in their homes is make sure they have access to food. And that would mean, for me, having prescriptions available so that they could get their food at reduced costs or free through the Medicare, Medicaid supplemental nutritional. So that's the way I'd go with that. Thank you.
All right, so I think a lot of this is about access to care, because for seniors to stay in their homes, they need to have access to affordable health care. They need to have access to their physicians or a healthcare provider when they need it. So I have voted for Medicaid expansion, and I was proud of that vote in 2015. I voted for funding for direct care wages increases, and I think we need more of that. What I would like to see now is I'd like to see expanded opportunities like more telehealth, which I've been promoting through my position on the board of St. Patrick's Hospital. And I'd also like to see us explore more mobile clinics to see if we could go out to more rural areas and provide an easy point of access for people living out there so they don't have to travel miles and hours to get into town. It would help them stay in their homes longer. I'm also interested in looking at how we can increase the number of healthcare providers. I think that Patrick touched on something interesting. We need more nurses, which means we need to actually put more money into education for nursing slots. What else we could do, though, is we could expand what the nurses in Montana can do. We currently have very few recognized licenses for nurses. We could look at having a nurse practitioner who specializes in neuroscience. It would help with dementia and Alzheimer's care, and if they were a nurse practitioner, they could then help in those communities. We could also look at increasing the prescriptions that pharmacists can give without having to have somebody go to a doctor to have the prescriptions filled. So those are some of the things I'm interested in. I also am interested in new ways to fund direct care wage increases and different programs that could help seniors stay in their houses longer.
Shane Morjo, House District 95. I think bottom line on this particular question is we need resources for it. We need funding, and I think we need to start thinking more outside the box on how are we going to get more resources. Well, and first off and foremost, I consider this as an essential service. So where do we get the resources? Well, we need serious tax reform in Montana. We haven't done a lot of tax reform and a very serious tax reform in a long time. It's scary to me to think that my parents or grandparents, all my grandparents are actually deceased at this point, but that my parents could end up living in assisted living or in their home without essential services. That's a scary thought to me. I think we need to start looking at places where we can get more resources, such as the top 4% in Montana who aren't paying their fair share in taxes. We need to look at ways to fund education so that we have individuals going out into the community, Montanans going out into the community, getting jobs, filling the over 6,000 jobs that we have vacant right now, paying taxes, putting that money into the state coffers so that we can provide these resources for all Montanans, especially these necessary and essential services.
So Tom Winter, House District 96. I should state for the record also that I work in home health care, so I get to cheat on this one. And also, I cannot agree more with what the people have said before me. So I'm going to more focus on the over 65, the senior aspect of this question. In my job, and also just what I've seen as living as a Montanan and as a human, seniors in today's world face kind of a constellation of negative forces as they age. And being able to age in place is one of them. And while we might have Medicare, it does not necessarily allow you to do so. Study after study shows that allowing your seniors to age in place and changing their homes rather than moving them out of their homes into assisted living facilities leads to better care outcomes. And I will do everything I can in office to make sure that that's the case. I secondarily should say that having worked and just been in outlying areas from Missoula, here in downtown Missoula, while we might not have enough beds for the seniors that need assisted care in facilities, there is no facility outside of Missoula often. And the fact that we have absolutely no care in 2018 in America, I think says a lot about the state of our healthcare system. And that's, again, as I've said, and I'm sure everyone has here, why I cannot support Medicaid expansion enough, and also why I think we need to keep looking at different ways to make sure that we have community models of care, especially for our underrepresented and our rural communities. So, thanks.
Well, I kind of agree with everything, with the statement of the issues that has been stated before. And I agree that is an issue. I have experience in the healthcare and the issue. I have a degree and I have a master's in social work from Portland State, and I worked for the Administration for Disabling Disabilities for 10 years and the administration for Native Americans. And presently, I'm working for a school testing company. A lot of the problems with seniors staying in their home has a lot to do with their family support, and if they have families that are supportive of that or are trying to convince them to move out so they can get the assets that the elderlies have. I don't know what to do about that, but I do agree that especially in the rural areas, there are very little help that is being given, and there needs to be a way to figure out how that can happen.
Representative Willis-Curry again. You know, the old adage, there's no place like home, rings very true in this situation. As I go through House District 98, I see a lot of folks in their 80s and 90s at home. They're very comfortable, they're living well, and we have in this town a lot of services to help those folks, but we can do better. And I can't emphasize enough that we pass I-185, because that is critical to providing the resources, both state and federal resources, to allow us to do a variety of things. We seriously cut back on our home and community-based services in the special session. We have a lot of local nonprofits that can deliver services much cheaper than you can find in nursing homes and other institutions. And we need to make sure we fund those things. And when I vote to expand or renew Medicaid next year, one of the things that's there is providing more services for folks in their home. Thank you.
Hi, I agree with everything that has been said, but I want to make two additional points. One, I want to find out what's happened with home care and direct service care in our rest homes and assisted living as a result of the cuts that were taken. I know money was put back in, but there was a great deal of reorganization, and I'm not clear at this moment what exactly has happened and what services have been restored. I serve, by the way, on appropriations for Health and Human Services, so I spent hours listening to providers, both direct home care workers, assisted living, and rest home. What I heard from all three groups, group homes as well, are also there. The salaries for direct care workers, for home health care workers, are extremely low. And I'll never forget the provider from Polson, who was almost crying, and he said, I can't compete with McDonald's. They make more money going to McDonald's than they do providing for Montana's most needy citizens. The other thing that happens, particularly with elderly, but also with the other groups, if you have people quitting, coming in, imagine yourself, you're 84 years old or 90 years old, you have health problems, and about every 6 weeks you have a new healthcare worker. Imagine the disruption that is to you if you're developmentally delayed. I'm out of time for thank you.
Thank you all. Our next question will be addressed to candidate Sardo, and it's number 3 in the list. And that is, increasing health costs affect everyone, individuals, employers, communities, and the state. Preventing illness and disease can help in controlling costs. Tobacco use remains the leading cause of preventable death in the United States. It causes cancer and other diseases, costing millions in healthcare expenditures each year. Over 20% of teenagers self-reported using electronic smoking devices such as e-cigarettes, vape pens, e-hookahs, etc. Effective strategies to prevent tobacco use include tobacco tax increases, prohibiting use of electronic smoking devices where smoking is prohibited, and tobacco prevention and cessation programs, which can lead to significant reductions in youth use. Raising the legal age to purchase tobacco products is another strategy aimed to reduce the number of kids and young adults who start smoking. Please share your view on these strategies.
I have kind of a radical view about tobacco. I think that it should be banned, the factories should be closed. How many people have to die? I mean, if you had a gun, if somebody had a gun to your head, and I mean, the gun should be taken away. Why is this allowed to go on? I've had friends that have died from cancer. One lady grew up on a tobacco farm in North Carolina. She lost one lung, then she lost the half of the other lung, and it was really sad. As far as the kids, I think all those toys should be taken away from them. And when I see people with tobacco in their pockets, I try to take it away from them. Thank you.
Please.
I grew up with two parents that smoked, and they both started when they were teens, and it's something that I experienced my entire life growing up, and I think that it's probably the reason that I didn't start smoking, because whatever your parents are doing is, obviously not very cool. So I'm very fortunate in that regard, but to see what it's done to them, and I'm so fortunate that they both at this point have stopped smoking, and I know that because of that, I'm gonna have some extra years of my life with my mom and my dad, because they're not going to fall victim to some of the things that probably one more year or one more day of smoking would have done to their lives. So just like Nikki, and just like I'm sure everybody up here, I have seen too many people fall victim to this and the results that come from it. So I have no pity for the tobacco industry. The insidious things they do to keep people addicted, to go after kids, and the lies that they're spreading on our TVs right now. So whatever we can do to push back against them and try to make sure that fewer people are smoking every day, that lives are being preserved, is absolutely what we need to do. I supported the Clean Air Act to make sure that we're not smoking in public places. I certainly support I-185. I want to make sure that I get that out there to say that I strongly support Medicaid expansion, because it does do a lot of important things to making sure that health care is provided for people, especially those who have suffered because of the consequences of smoking. So we got to go after them, and we got to go after them hard.
Katie Sullivan here. I would like to just say that I agree very strongly with everything Representative Bennett's just said, and so I won't repeat any of that at this point, and I just want to also echo that I support I-185 and tobacco tax and prohibition on electronic devices where smoking is prohibited. Anything to get the smoking down, decrease the amount of smoking, especially for people that are just starting. And I also just want to commend candidate Sardo for taking such a stand, and I think that's really neat. So thank you for sharing that.
All right. I agree with everything that's been said, and I appreciate everyone sharing their perspectives. I just want to say unequivocally, I support I-185, and it really frustrates me to see some of the anti-campaign that's going on. I'm just going to stop there because I think we're all in agreement.
And we could probably just stop, but I want to talk a little bit. My story is very much the same as Bryce's, where I grew up with two parents who smoked, and they did stop eventually, but my father died an early death because of cancer, smoking-related death, cancer. Sadly, though, it carries on. My generation skipped, and I have a son who smokes, and it's just beyond me. I can't understand that. So I think we need to just do more education, and we need to create more awareness. We do know that raising the tobacco tax will help reduce smoking. We know this. It's the #1 cause of preventable death in our state. We know that it kills more people than alcohol, car crashes, drugs, homicides, and suicides combined. It hurts us financially as a state, and so I'm giving you another number here, with over $440 million in health care costs every year. So that ends up being an extra $800 in taxes every year that Montanans pay to cover the costs of smoking. And there's some other facts, like numbers I could give you, but this one I want to tell you for sure. Based on current smoking rates, there are over 19,000 kids in Montana today who will ultimately die prematurely from smoking. That's frightening. And I'm with candidate Sardo. I think we need to do something about this. Thank you.
Thank you all. Oh, I'm sorry. Yes, thank you.
Okay, thank you.
The pillar is in the way.
Agree with you on the tobacco issue. In the 2 sessions ago, I was asked by Attorney General Fox to carry legislation that for the first time identified in statute e-cigarettes. I carried that bill. What that bill did was it made e-cigarettes and vaping and all of that illegal, something we recognized, and it also prohibited minors from buying e-cigarettes. So it's against the law the same way as it is for alcohol for kids. Now, you all know kids still get alcohol, and kids have certainly gotten their hands on e-cigarettes because it looks like a pen for the most part. So many parents are not aware of it, and even in schools, while teachers are looking for it, it looks like a pen. But there are huge efforts in our public schools trying to deal with this issue, and we need to be spending more time on it. But I got to tell you, we wanted to go further in our bill in the legislature, but the interests of big tobacco and the vaping industry stopped us from really going much further than recognizing it and making it illegal for minors. And that's the same group that has been involved in making sure that, or the big money that's coming in against I-185 as well. So those interests are there. They continue to be there. They want to have kids addicted. You know, we try more heartily to enforce preventing kids from buying alcohol. We need to have the same kind of attention on the enforcement side to making sure that kids are not buying cigarettes and vaping products, both of those things. Thank you.
Thank you. This next question is addressed to Representative Dudek, and it corresponds to number 7 in the list. Montana's Medicaid expansion sunsets in July 2019. Are you in favor of removing the sunset? If yes, how would you suggest it be funded?
Montana's Medicaid is set to expand, or excuse me, is set to sunset. And no, I'm not in favor of the sunset. I'm in favor of expanding it. As we've been talking about, the access to affordable health care is essential. And expanding Medicaid in Montana increased the access to health care of tens of thousands of people. It also decreased the rate that those of us who already have insurance have to pay because there's no longer the uncompensated care that was causing our rates to rise. So I am definitely in favor of removing the sunset and improving the coverage that we provide. And as far as how it should be funded, we should explore all funding alternatives. We have talked about a few. There does need to be some tax reform in our state. We need to close what's called the water's edge exemption. It allows people not to pay tax in Montana and to pay tax somewhere else, or not to pay it at all, depending upon where they're claiming it. We also can look at reforming the structure as to what the highest tax bracket is. This was changed 20 years ago or so. There used to be a higher tax bracket that brought in more income, but I think in the Judy Martz administration that was changed. So I think we need to explore everything and recognize that health care is something we should all have access to. You shouldn't have to choose between buying food and buying insulin, and that we need to treat it more as a right than a privilege, and we need to do everything we can to make sure people have health care.
I echo everything Representative Dudek just said. I grew up low-income family. I mentioned earlier that all of my grandparents passed away before I even knew them, and I believe healthcare, especially with two of them I know for a fact, was a major contributor to them passing away at a young age. Behavioral health is a major piece of this that we need to see expanded with Medicaid, funded with Medicaid expansion. We know that in Indian country in Montana, American Indians die at roughly 20 years younger than other white Montanans. I just find that unacceptable, and with Medicaid expansion, we've seen we're closing that gap. We see thousands of Montanans having access to health care, preventable health care, where individuals are going in and getting early screening, detecting cancer early on, other illnesses, to where they're actually not costing the system more money in the long run from emergency visits when their symptoms get severe and practically untreatable. So I definitely support Medicaid expansion. Expanding it even more is a no-brainer to me. I think everyone in Montana should have health care.
Since I couldn't agree more with the two people before me, I'll just go with the things we would lose were we to allow Medicaid expansion to sunset. I apologize. That's the healthcare of 97,000 Montanans would be taken away. That is what, $350 million in new spending in our economy. That's every dollar that Montana invests in Medicaid expansion, we get $9 to $10 back. And that's money that's invested in people's health. Those are real people who live amongst us. And 96 to 97,000 people is 1 in 11 Montanans. So some of the people here could very well be on that program. And going door to door, I have met so many people who have family who rely on it themselves. And I just truthfully, this is something that I'm running on very hard. I do not want to live in a moral universe where we take this away from people. And let alone the fact that it actually saves the state money. So I couldn't be a bigger defender of the program. And again, I believe that there are many different ways we can fund it. It largely self-funds in the first place, but we can look at increasing the capital gains tax or increasing another tax bracket and decollapsing it from what we did in 2005. Thank you.
Well, I do support the expansion of the and continuation of the Medicaid. I have maybe a different perspective. I don't think, well, one of the criticisms usually is the funding mechanisms for it. Well, with the expanding economy that we have in Montana and the United States, I think fewer people will actually will be needing it, as they probably will be having insurance and so forth with their jobs and so forth. I read a recent study of the Foundation for Government Accountability, and which said there's 47,400 Montanans are on food stamps. Out of that, 65% of them are, or 30,810, are able-bodied persons. That shows the extent of the low income and low pay that our state has. If we could figure out a way in which we could get good paying jobs come to this state, some of these problems will not loom as large as they are to us, assuming that we're continuing below pay. But I think we should continue the program, and I also think that the expansion will be okay, but won't be as expensive as some predict.
Well, it's Kurt here again. So a little bit of history. During the 2015 session, when we passed Medicaid, we had to take several runs at this passage. And part of the politics in solving this issue of getting it across the finish line was to accept the sunset. That was unfortunate because we're back at it again. Any renew of Medicaid expansion has to be without the sunset. And so the question is, how do we fund it? Well, we've mentioned a variety of sources, but just remember, for every dollar that we put into Medicaid in I-185, we get $9 back from the federal government. So that is a critical element in making this program function and function properly. Now, we may have to look at other sources in the future, but with that federal money and the resources that are available under 185, we should be able to make this program work for some time.
I agree with everything that's been said. The reauthorization of Medicaid expansion is essential. I can't imagine telling 97,000 Montanans that you no longer have insurance. One of the things I want to mention is that what makes this program so significant, it treats the whole person. There's mental health care, there's dental care. The whole person is treated to help create a healthy society. There have been some tax proposals suggested. We need to look at all of them. Our tax structure is out of balance, and the proportion of tax paid by middle income workers is much greater than the proportion paid by those who have much greater than middle income. The third thing I want to mention is, having been on the doors since about March, the ad that's currently running, claiming that Medicaid expansion will do perpetual funding from the state, you've already heard answers about what that'll do. It's having an effect. So I'm asking each of you who care about Medicaid expansion to take it as a personal challenge to try to talk to people about it, because they are fooled by that ad. They are being convinced that it's going to be a perpetual program. One other thing, if I have time, I don't know if I have 15 seconds. There is a work requirement that connects able-bodied workers to employment services in the state of Montana. It probably hasn't worked as much as we had hoped it worked, but it is working. A lot of the people are on. I'm out of time.
Patrick Maloney, District 97 again. I would say that we need to remove the sunset as well, as everybody else has. Funding, for me personally, the 185 is one option, but I think that's insufficient. I would like to see funding come from the legalization and taxation of recreational marijuana, allow the medicinal users to operate at the same rate that they're at, but let's go ahead and bring in that other tax revenue. Last year we made $1.3 million off 29,000 medical marijuana card holders. If we were to get regular people in there for recreational marijuana, we would see enough money coming in through just that tax source alone to be able to help fund Medicaid expansion for every Montanan.
Thank you very much. Our next question is addressed to Representative Bennett, and it's number 5 in the list. This is, how would you address the suicide and substance use epidemics in Montana as a legislator?
Thanks. This is another one that's touched my family. Not so long ago, one of my uncles, who I thought was doing just fine, ended up surprisingly taking his own life. And actually, just a couple weeks ago, another one of my uncles attempted to take his life. And I know that my story is not that original. I'm sure that here in Montana, the state that leads the nation in the worst possible category of suicide, everyone has had a friend, a neighbor, a family member affected by this problem. And I'll tell you that as a member of the State Administration and Veterans Affairs Interim Committee, that's something that we took very seriously. We took on this issue specifically for our veterans who experience it at a higher rate than anyone else. And we were able to put together a package of $500,000 to try to make sure that we're connecting with people where they are, because that's what it's going to take. It's going to take a cultural change. Because in Montana, there's a lot of benefits that come with being a live and let live kind of state, but it also leads to a lot of isolation. It also leads to people not reaching out for care when they need it. And it's a lot of people who think that they're the only one that is depressed. They're the only one that has anxiety. They're the only ones that are going through some of these terrifying and lonely moments. And they don't realize that even if you're a tough guy, because men are much worse than this than everybody else, you got to reach out for help. You got to reach out to somebody that can give you guidance, that can help you through these really difficult times. And if we can do that, if we can make it more normal to reach out when you're in these tough places, we'll be able to start stemming the tide and being able to lower Montana's suicide rate.
Katie Sullivan here. I'd also like to just make 2 points. One is echoing, again, Representative Bennett, because he's so smart. Ending the stigma associated and attached to suicide being seen as a weakness or a burden. We need to have that stigma end, and we need to have attitudes change, especially considering that depression is very common. Financial crisis is common. Relationship issues are common. Alcohol dependency is common. These are things that we all experience or have in our families, and they're contributors towards the increase in suicide and drug dependency and abuse. And so these are things we need to talk about. And then the other thing is that depression and mental health issues are treatable, and people can get treatment when they seek medical care. And so to that end, just making sure that we maintain access to affordable, accessible care for all Montanans, however we can, whether that be through maintaining Medicaid expansion, funding our mental health programs fully, and doing our best to prevent cuts to DPHHS. Those are some ways that maybe we can help stem the tide in suicide.
Thanks. We absolutely have to destigmatize both suicide, mental health, and substance and alcohol abuse. These affect everybody. I've lost 4 people in my life to suicide. I've nearly lost some of my closest friends and family members to addiction. One thing I'll do in the state legislature is support Medicaid expansion and funding mental health programs at all levels. I dream of a day when this is not broken out separately as a health issue. I mean, goes back to what we were discussing at the beginning of taking care of the whole person.
So I wake up every morning and I wonder if there was something different I could have done to have kept my kids' dad from committing suicide. You know, I'm one of many families that have been impacted. From 2014 to 2016, 63% of all suicides in Montana were carried out with a firearm. I think we need to look at that. We need to look at ways to maybe help keep firearms away from people who are in crisis. Not sure how to go about all that. I will support suicide awareness efforts, and I believe that it is essential to ensure people have the services they need. And I don't think I've gotten to say it yet tonight, but I support Medicaid expansion. And I will do everything to make sure those services are available for all Montanans. Soon-to-be Senator Bennett touched on something that I just wanted to stress. Sometimes these people we don't know who they are, and we have to find ways to have empathy for what people are literally going through at that time, whether it's raising your family as a single mom or someone who loses a job. We need to be available and open and have support services. I'm done.
Thank you. This topic is important to me for many of the personal reasons they talk about, but also because I serve both on Law and Justice and on the Children and Families Health and Human Services Committee. This topic is one that we've been working on for some number of years. I was very involved in the first suicide funding of our suicide program at the state level. Let me talk just briefly about substance abuse issues. I convened a hearing in the last legislative session on substance abuse, particularly opioids, et cetera, which was very well attended by legislators, people in the community talking about important programs we put together. And as a result of that, we did create a license for a peer-to-peer counselor relative to substance abuse. I think it's important for all of us to remember that the biggest substance abuse we have trouble with is alcohol. Opioids are a serious problem, and meth. Yes, they are, and they are part of the reason the presence of the cartels in Montana is an issue, particularly to be addressed by law enforcement, and particularly a problem on our reservations where there is no other form of work, and they're sitting ducks for the cartel. So there's both that component to it. I work very closely on the Substance Abuse Committee of the Department of Health and Human Services, and also with the Attorney General on this, and there's an entire package of bills going to come forth, everything having to do with the prescription drug registry, having to do with maybe limiting the number of opioids people can have, revisions to our DUI laws that get rid of the look back. If you've got a substance abuse problem with alcohol, you've got a substance abuse problem, and if you get picked up twice in 10 years, it should still count. So there's a lot of work being done in that whole area, and I'm very pleased to be part of it.
I personally believe that there should be roadblocks put all across Montana, back roads, highways, sporadic, so they're not counted on and people can't get around them. And they should do really bad things to the drug dealers and the runners. I have someone in my family that's addicted, and there is no addiction center in Montana that we can afford. So it goes on and rips apart families in many ways. And as far as the suicide rates, it's 4 out of 5 are young males that commit suicide. And I think it's because girls and women have friends and family to chat with, and guys don't do that. And I think if teachers possibly would see the tell and know who the people are that are potentially suicidal, would direct them to counselors and get help as soon as it's been seen. Thank you.
Thank you all. The next question is directed at Representative Morgeau. This is number 12 on the list. Given the budget crisis this past year for behavioral health in Montana, would you support funding behavioral health in Montana with a consistent revenue stream, either through an income tax over $1 million or some other constituent method?
Absolutely. I don't necessarily think an income tax is the only place that we should be looking, though. And I'm not convinced that is really the direction we should go in. I think, like I said earlier, we need complete tax reform in Montana. I absolutely support funding behavioral health in Montana. As we just heard a lot of information from individuals talking about sharing stories. I've had family members in my family who have committed suicide. My sister committed suicide when I was in middle school. So I can't stress enough all the attributes. There's so many different things that behavioral health does and can do, and I think expanding that and looking at ways to fund it is a no-brainer, especially when we have such a high suicide rate in Montana. I do think it should be something that is consistent revenue stream that's locked in, where we're not coming back asking for money for behavioral health. I think it's tied in with other issues such as addiction as well, and so I think we have to start looking at things bigger picture and how everything's connected, and I think that's one place to start, but I do think funding it is obviously, funding in Montana is a difficult thing, and I think we need to look for various resources for that.
I agree with Shane. I would say behavioral health it's a basic service, and for us to be treating it as if it's something that can be cut, whereas other things cannot, shows, I think, how far we have to go with the stigma surrounding behavioral health and treatment. And while, revenue-wise, I can argue all day about decollapsing the top tax bracket or increasing capital gains. Shane has the better point that our tax system in general is funded on the backs of the middle class pretty much exclusively. And if we are going to decide to have a society in Montana where we do not tax the wealthy the same way we tax the middle class, and we pay for that by not paying for behavioral health for those who need it the most among us, I think we should take a hard look in the mirror. And again, I've talked with people about this before on the doors and in other places, and I have family that have, had some serious mental and behavioral health issues. This is something that affects everyone, and it's just a basic service of the state. And to act like it's not and to continue to not fund it correctly, it shows a lack of courage on behalf of our legislators that I really wish was there. So, thank you.
Well, I do support of helping the behavioral health industry in Montana. What I'm fearful of is that everybody keeps on talking about needing more revenue, and to me that is kind of a dog whistle for we're going to end up with a sales tax. And I'm absolutely opposed to a sales tax and will not consider it. One of the things that, and the problem in Montana is that we rely so heavily on taxes coming out of people's paychecks. We need to. We were a wealthy state one time, and we were wealthy because we had an extraction industry with mining and logging and so forth, providing excellent jobs that provided high income for the men and women who worked in them. Well, we need to look at these industries and see if there's any way we can support them, and so we can regain the income flow that comes through them. If we did, I think we could avoid a sales tax. There were, 13 tax proposals in the last session, and there will probably be more in this one, and everybody's starting to talk about sales tax, but I would oppose it.
Don't start my time yet. Okay. I-185 plays a key role in making sure we go after sufficient, well, I wouldn't say sufficient, but more behavioral health resources. That's part of the initiative as it is. But with adding the extra money that we get from the federal government, we will have a surplus out of I-185. I'm committed to take some of that money, or a fair chunk of that money, and put into a mental health program. We started on a great track of improving our mental health program in the 2015 session. But unfortunately, the budget situation of the last session ended up, especially the special session, cut a lot of that mental health money. We have the opportunity with 185 to generate the resources to fund a robust mental health program. Is it enough? Maybe not. As a classroom teacher, many times we were on suicide watch for our students. I understand the mental health problem in the state, but we need to make sure that we adequately fund it, and we have the opportunity to do it.
If a bill that had a particular stream flow of revenue was going to go support mental health, I would definitely support it. But I want to bring, I should say one other thing. My mother-in-law had mental health issues. And if it wasn't for a family that was able, with resources, to take care of her, she would have been in the street. So this is a very personal issue to me, to help families get the mental health care that they need. It contributes to all kinds of other issues we pay for in many different ways. But I want to bring just a touch of realism. Remember, I said I would vote for this if it came before me. Years ago, there was a tax to support education from gambling, and part of gambling was sold on that tax. Well, I won't go into the story, and Diane probably knows it better than I do about what happened with that tax. But people still believe that education is being funded by gambling. It is not. And I'm fearful of that. So things can change. Legislatures can change. And so I do have a bit of a qualm about it, but I would vote for it were it in front of me.
All right, let me start by saying that I am a proud Moms Demand Action for a common sense gun control candidate. And the reason I'm starting with that is because in becoming a gun sense candidate, I was doing some research, and I found that there is one mental health practitioner or behavioral health practitioner for every 244 people in this state. So we can go ahead and talk about funding mental health and behavioral health programs, but unless we have the staff to administer the program itself, we're funding dead air, dead space. So not only do I think that we need to fund it fully, but I think we also need to make a very big push at getting more mental health practitioners into this state, into positions in the rural communities where we need it the most, and help the people find their way through the mental health practitioners. And the funding at that point, I think, will start to come in when people are doing better physically and mentally. They're doing better in their jobs. They're doing better in their lives. And so funding is naturally going to progress as we bring in more practitioners. Thank you.
Kimberly Dudick for House District 94. So I do not believe in a sales tax. I think it's regressive and it taxes everyone who shouldn't be paying more on goods. But I was on a subcommittee this last interim session dealing with the changing tax structure in Montana. And what I had our legislative fiscal division look at is what we can do besides raising, we keep talking about more funding. Well, what else can we do and what happened to our money that we had? Well, let me tell you what's happened. We had some nice pie charts that were very color-coded and put together, and over the last 3-4 decades, we have come to increase to depend on individual income tax from about 25% in our general budget to now it's over 50%. And the second highest thing we depend on is property taxes. So if you work or own property, you are funding about 75% of the state. And the things that haven't changed is the oil and gas only accounts for about 2% of our revenues, and the corporate income tax is about 5%. So those have been unchanging. So you're like, well, then what's happened besides those things? Well, there are some fees, that about the 10 main feeders that go into the general revenue, that if we would increase things such as, that haven't been changed for decades, like the investment license fee hasn't been changed for decades. Different fees, if we increase them, would bring in $70 million more every year to our state. So we need to look at other things we can do besides new taxes. These are things that already have been approved. We also need to focus on prevention. I passed the anti-bullying bill after a decade of people trying. We finally got that passed, so maybe our children's mental health will be better if schools can guarantee they learn in a safe environment. We've also focused on child welfare reform to make sure our kids are safe, because they're the ones who are taking their lives.
Thank you. Our next question is directed at candidate Sullivan. It's number 13 on the list. The nation is facing two public health epidemics related to prescription drug abuse and under-treatment of pain, and Montana is not untouched. In response, steps have been taken at the national level to legislate guidelines, and states have adopted strategies on this with recognition of its relationship with need for mental health and addiction services. Patients suffering from chronic pain have felt stigmatized and felt the impact directly. New regulations created challenges in access to care that they seek, and promoted alternative therapies, have limited liability and insurance coverage. Montana is one of the few states that has seen decreased opioid prescriptions and death rate associated. What policies would you support that strike the vital balance between addressing this critical need to curb the abuse and illegal use of prescription drugs, while also ensuring to crucial opioid pain medications for cancer and other chronic pain patients who have a legitimate need for pain relief?
Great, thank you. First, I'd like to go ahead and recognize that chronic pain is real, and there are people out there that need opioids to manage their chronic pain. And so I believe any limitation, well, I don't want to say any limitation, but limitations or trying to ban prescribing of these drugs is probably not the answer when they're being prescribed by a physician to their patient for their chronic pain needs. But at the same time, I would like to say, in terms of steps I would support to help decrease this epidemic, is one is maintaining physician education through their continuing education classes that can discuss opioid administration and pain management. There's always, every year, new research that can come out that can assist our physicians in making good decisions. Second, I would like to attempt to destigmatize opioid use so that people feel comfortable reaching out for help. And then third, continuing to utilize a drug registration program and making any necessary improvements to streamline that and to make it as efficient as possible.
Thank you, Katie, for those answers. This was one of the questions where I thought, I need to educate myself more about this, because this particular issue is not very familiar to me. It is my understanding, too, that ongoing physician education has been making a difference, that there's a big change in the recent years of how caregivers view opioid prescriptions. I want people to have those medicines if they need them. I'm also really glad that medical marijuana is becoming more and more accepted. I understand that helps a lot of people. This is an issue that I am sensitive to, and I look forward to learning more.
Okay, so in 2011, the Montana legislature authorized the Montana Prescription Drug Registry, and it's been functional with some quirks. I understand that it's a little bit awkward to use since then, but it is not mandatory for physicians to use it. And I wonder if there were a way to make it more usable and mandatory, if that couldn't help. I mean, we've made great gains. It looks like we need to definitely make some more gains with that. As we know, any addiction needs to be managed and treated. So first of all, we have to recognize that there's an addiction and then make sure that the right services and treatment is available. And that's not happening to everyone with an opioid addiction. It's not just about that individual either. This really affects families and our communities. So identification of abusers is crucial, and one way to do that is using that registry efficiently and mandated or something. Okay.
Hi. Once again, these are the issues that come regularly and we've been working on in Children, Families, Health, and Human Services and in Law and Justice. One side effect of this problem with drug abuse, I should tell you, is that the state currently has 4,000 children under its care. 4,000 kids for abuse and neglect, much of it related to this particular problem. So it's not just the individual. So prevention's a big issue, treatment's a big issue. Some have been mentioned here. We're working on issues related to physician assistance. When I ran Partnership Health Center, for example, we had a suicide of a patient of ours, not our prescription, for a Schedule I drug, an opioid. What that required to get into compliance was probably a half an hour of time with a patient in terms of patient screening, patient education, follow-up, small amounts of drugs being given to them, and monitoring over time. All of that has to happen. It takes time to train physicians and then to require them to be in compliance to do it, as well as our facilities. And that's something we're working closely with the MMA and others to do that. Secondly, and that's the Dental Association, the Medical Association as well. We're also moving toward what's called MAT, Medication-Assisted Treatment, and we're hearing that within corrections and other places, that recognizing that your brain is changed when you are addicted to these drugs. You're never going to be not addicted. So realizing that we're going to have to provide lifelong assistance and treatment, just like if you're in Alcoholics Anonymous, and certain drugs that can help people live with that addiction throughout their life and yet not crave it and fall back into the dark hole that we know it is. Thank you.
I don't think that there is a fix for addiction. Sorry. Like Diane said, they go into rehab 6-7 times and they're always going to be addicted. The pain level for people that have cancer, if it's like an 8 or above, I think there should be no control on the opioids that they can get. They should be pain-free. Mental health, I think that it cannot be fixed by therapy. I don't care how much you talk. I think just drugs are the answer, because the brains are just a little bit tweaked and they just need a little help with drugs. My father was a psychiatrist back in the 60s. He died when I was real young. But he'd come home with all the stories and from the where they lock up the teenagers and everything, and I heard everything, and therapy didn't help anybody. Thank you.
You know, I obviously agree with a lot of the things that have been said here. I think that making sure that there's that education for our doctors so that they know some of the warning signs when somebody shows up at their office, you know, saying that they have pain, but maybe they've been shopping around to other doctors, making sure that, you know, that people, that we have some sort of a system to make sure that if people are popping up at different doctors' offices asking for the same thing after they've already been given, you know, the opioids to treat their pain, there should be some red flags that go off. But beyond that, I do believe that we need to trust our doctors. You know, I think that having some oversight there to make sure that people aren't taking advantage of the system and that we don't have doctors that are, you know, acting out of line is certainly something that needs to be in place. But making sure that when people have pain, you know, it's being treated, because it's one of those awful invisible illnesses that, you know, so many people struggle with, but it's not a way that you can show it, like a cut or a, you know, or a surgery or something that is so much more visible to people out there. And I think the biggest thing beyond that I think has been said before, is that we need to have more funding for treatment. You know, that's a huge issue in this state, that we expect a lot of people to just either go to jail or get better by themselves. And we got to do more as a state to ensure that we have that option of treatment so that people can get their lives back on track, so they can be productive members of society again. Because if we don't have that, people are going to be in this revolving agony for a long, long time. And that's something that we as a state have the ability to change.
Thank you so much. This next question is addressed to candidate Winter. It is number 6 on the list. By way of Title 50 of the Montana Code annotated, local boards of health have the power and duty to identify, assess, prevent and ameliorate conditions of public health importance. This can include adopting local rules. Do you support or oppose the authority of local boards of health to adopt rules that protect the public's health in their communities? Why or why not?
Thank you. In most instances, I think that the more local you go, the better type of government you're going to be having, especially in the state level down to the county level. And I realize that public health is often the purview of the county, not the state, and not the state legislature. And I think the system that we have now, while imperfect, is working. And I believe that while there can be certain health aspects that are not related to the entire state that can be seen better on the county level, because our county level providers, nurses, MDs, CNAs, et cetera, really are kind of the sentinels of our healthcare system. They need to have the flexibility to be able to do what they need to do to serve their populations correctly. So I'm in support of it. I don't think it should be changed.
Montana is interesting in the fact that we have what we call urban centers, and then we have areas that are very rural. I would be concerned. I do support local control of this, but there needs to be some sort of state standards, because you get it over in some smaller counties, they're not delivering anything. Basically, what they do is shift all their issues to the large urban areas around them. I know it's a funding issue, but it's something that should be examined. I really don't have a solution for this, but I do know that local control is always good. I believe in local control for education, and surely local control for health would be fine. But there needs to be some sort of state standards, so at least there's a minimum standard, and then there probably is, but that's what I believe.
Yes, I do believe that local governments should have authority to identify, assess, prevent, and ameliorate conditions of public health importance. But as mentioned a minute ago, there's some places where things fail. And we've seen around the state of Montana, especially I'll go into the northwest part of the state, where we had a situation occur that's had a long-term impact and a deadly impact on a community, where the local health board, I think, didn't respond soon enough to a very massive health crisis. And so as a result, I would say yes, but the state has to play a role here also. It's a partnership, because frankly, some communities do not have the resources to respond to a serious long-term health crisis.
This is an issue I really need to be educated more on. I thought a lot about it, and I can see pluses to having local control. You address issues that only occur in your area, or that you can respond to quicker without having a state step in and have to go procedures. Locals can prepare those. On the other hand, you have issues such as measles, where you have an epidemic with one area, and having been a teacher, you look at that as schools, especially where kids go to a basketball tournament, and suddenly we have lots of people who've been exposed to something. So I really need more information on this. Local seems the most reasonable, but I need to be educated.
Okay, so we have a fire department at a local level. We don't have a fire department at a state level. And there's a reason for that, because at the local level, they can respond quicker to issues that arise in a community. So I would say that yes, we do need to have the local health boards that are able to do all those things immediately when we see a problem. But we cannot leave the state out of it. We need to make sure that there's a state facilitator there that's going to oversee the local boards, and when something happens on a statewide level or a level that the state might want to inform the local boards of, then they step in and they take over where they're needed. But I do believe that we need to operate on a local level throughout the healthcare system, because ultimately, who knows you better than your neighbor? And so we can't just allow the state to go willy-nilly without having some sort of local board as well. So I support the local board option.
Thank you. I agree with everything that's been said. I think we all kind of agree that local is good. It lets us respond quickly to local needs, but it is good to have state oversight to ensure that these certain standards are being met. In Montana, we have a right to a clean and healthful environment. All Montanans, it's a constitutional right we all enjoy. And we need to ensure that our local governments have the resources and the ability to enforce that right. It is a funding issue to some degree. If you leave it all to localities, they may not have the money to quickly respond, or they may not have the manpower to do it. So that's why it's also important to have coordination with the state. So I support this, but it does need to have some backstop on it at the state level.
You guys could skip me. I know I'm monotone sometimes. So, I agree. I think Tom did a very good job of, candidate Winter did a very good job of breaking this down and talking about the need for this. I think each of our communities are a little bit different and have different needs. I know the health board in Missoula is responsible for the health officer who directs the city council health department. And so obviously the city council health department in Missoula is going to look a lot different than Polson, perhaps. So I definitely think there are some things that local communities, whether it's, for example, something like food handling, I think there's different needs in Missoula. You know, we have a different community even in our downtown area that calls for different standards. So I think local makes sense, but I echo what Representative Dudek and Representative Curdy also said about the state oversight of having some level standard for everyone to play off of, so that community members aren't being essentially cheated out of a healthy community.
Thank you all. Our next question is directed at candidate Marler. It's number 11 on the list. In Montana, more than 2/3 of children live in families where parents are working. However, nationally, only 12% of workers have access to paid leave to care for themselves or a family member. New parents who have access to paid maternity leave are twice as likely to return to workforce within a year after giving birth. Furthermore, many Montanans are faced with caregiving responsibilities for aging parents or other adult family members. In a survey of Montana voters over the age of 45, over half of those surveyed have or are currently providing unpaid caregiving assistance to a family member. 4 states have implemented a statewide insurance fund to help provide workers access to a portion of their wages when they have to take time off to recover from their own illness, to care for a seriously ill family member, or for parental leave. To be clear, employees contribute a small fraction of their pay to fund the paid leave program. Would you support a bill to enact a similar program in Montana to provide workers access to family and medical leave?
Okay, so this question has a lot of great information in the question. And it ends with a kind of a yes or no question. So I'd like to say a qualified yes, that if that bill came in front of me, I probably would support it, but I feel like there's some bigger issues captured in the question itself, having to do with the low wages that are paid in this state, with gender roles and gender pay equity in our society, and the fact that people are living longer than ever before. Things that I need to educate myself more about is and the aging parents issue is affecting me and my husband now, and I need to learn more about how having dependent parents affects one's tax status. I think that I think we need to increase the minimum wage. I think that we need to require more paid leave for one's own health care and for taking care of dependents' health care. I'm not sure exactly how to do all of those. I feel like saying, hey, there's a law and you can set aside some, like helping somebody plan for some emergency medical costs is not a bad idea, but I don't think it's the first thing that I would lean on. And I do appreciate the discussion that comes with this question.
So, I very much like the idea of paid leave, and I am grateful I work for an organization that does provide that for their employees under certain situations. Everything that candidate Marler said, I have to echo. I don't know enough about how this would work in our state. I don't know if we've even done a study on this. It's important. I understand it. I think I could support a statewide insurance fund, but obviously we need to look at how the other states have set this up and how it's worked and what kind of wages are in those states to help contribute. It's something I'd like to learn more about also. Thank you.
Excuse me. This is one of the topics that the legislature's been working on for decades, frankly. We're one of the only countries in the world that does not have paid family leave. It's not innovative and new. It's something that's the standard in most of the world, and we just plain don't do it. And we should. It has a disproportionate impact on women because when women leave the workforce and they're not being given credit for work in the home, they lose traction. We're already making 75 cents for every dollar a man makes. You lose money as a young person staying home, and usually women with their kids. And then when women are at their prime of earning and their contribution to the economy, they are stepping back, moving to take care of elderly parents, working part-time as well, so they're losing there. The cumulative effect of that is that women over a lifetime lose over $1 million as earning capacity, which affects their retirement, et cetera, which is why women and elderly women tend to be more in poverty. So we have looked at this issue in a variety of kind of ways. It was certainly a major component of our study of Alzheimer's and dementia care because the caregivers are predominantly women, and because the stress of not having adequate respite care, which we've tried to provide funding for through aging services, again, these are things that got cut, caregivers can tend to die sooner than the person they're caring for. The stress is so great. So this is a critical need, not just for raising small kids. Do we support families or not? Are we family friendly? Do we have a commitment to family, kids, taking care of elderly people or not? The answer in this society is we don't.
I would say yes to this if it was like a savings plan from their monthly income. I would say if it's not mandatory that they have to do it every month, put money into the savings plan. And I would say no if a business owner has to match or is taxed extra for this program. Thank you.
I'm very intrigued by this idea. This is the first time that I've heard of it, and I think it's something that is interesting and should be explored more. I try to make a habit of not agreeing to support bills before I have the text of the bill in front of me, but I think that we can all agree that we got to do something about paid family and medical leave. I mean, this is exactly as Senator Sands said, it should be the expectation. It should be the law of the land, and it should be just a basic element that people can depend on when they get sick, when they have a family member that gets sick, to ensure that they're not falling back in their career, that they're not falling back in their lives. I know that from door knocking thousands of doors at this point, I hear stories from people all the time who used to have home care workers come to their house to, help a loved one get up in the morning, get breakfast, get ready, often to go out and find a job that they work for. And because of the cuts that we saw in the last legislature, people that used to have daily visits now get a visit maybe once a week, maybe once every 2 weeks, maybe once a month. And because of that, a lot of families are having to step in, and a lot of people that used to be able to have those jobs, used to be able to feel productive, used to be able to get out of their bed, are now falling back into some of the most vulnerable places that they've experienced before. So we have to address this. We got to make sure that not just for the people that are sick, but for their families and for everyone affected in their lives, for our economy, we have to address this right away.
I would like to go ahead and say I agree with Senator Sands and Representative Bennett on their points. I support the idea of paid leave. I would like to see some creativity in bringing that type of bill to the Montana legislature. It's something I would definitely be interested in working on. This is something that our federal legislators have been trying to work on, and they can't seem to get much done on that. So then that pushes this to the states, and so this is us making attempts to take care of this problem. And so we will, and I think we should. And then just thinking about the 4 other states that have already enacted this type of legislation, we can look to them as a model to see what their successes are, where their failures are, and craft something that would be good for Montanans.
And this will be our last question, and then we'll be taking questions from the audience. So this last one is addressed to candidate Sadler, number 14. At least 18,000 Montanans help care for adult family members or friends who have serious health conditions. Our long-term care system depends on the assistance of these family caregivers, many of whom juggle work and caregiving. As a legislator, what would you do to help support family caregivers?
Well, this is interesting. Question that I should start this out because I have been a family caregiver most of my adult life. When my first wife died, we had 5 small children under the age of 9, and as you know, you cannot hire a mother, and because the children were so young, I basically had to figure out a way in which to earn a living at home. And that's why I went to social work school and developed a practice that I worked on my computer. So I'm very aware of this need. I then built a little house next to my house, and guess what? All my parents, my new wife's parents, and my children have all moved in there one time or another, and we've been caretaking for these. But not everybody basically has the talents evidently I had to do this. I really have no real solution that I can come with right now and say this is the magic wand that how it needs to be fixed. I do know that it needs to be fixed, and surely out there are some solutions that we could look for.
Providing care for adults is probably one of the most vexing problems the state faces. We have some really, really impressive programs going on locally here in Missoula, for example. I'm looking over here at Susan. They do a wonderful job, but they're the exception. Long-term health care in the state needs a lot of work. So again, with 185, we have access to additional dollars that will come from 185. And besides mental health care, this is one area where we could see some serious work. I think Missoula Aging Services sets the standard, and we have other programs in the state who definitely could benefit from this, and it's something that needs a lot of work and a lot of support. And I'm all in.
I agree with Willis 100%, having gone through this and retired much earlier than I ever intended because I had my mother to take care of. I was fortunate to have other family members. But I also had Missoula Aging Services, and when I got desperate, that's where I went. And they helped me, and it didn't take me forever to get their help. I got it right now. So one of the things I think we're responsible for is making sure there's adequate funding, not only in Missoula, but all over the state to provide that kind of service. In addition, when dealing with individuals who need a lot of care, you get worn out, you get burnt out, you get tired, you get sick yourself. And so that part of the program, there is a way to pay family members, or if that's not the option that we can support, although I would support that on a temporary basis, is also to have volunteers or paid workers who come in and give the healthcare the family member, a relief, a respite, and allows them to get away for an afternoon, go sit in the park, go take a walk. It's vital because it is extremely difficult on every aspect of your life when you care for a loved one. Even though you want to do it, you would never change, but people need help to do it. And thank you, Missoula Aging Services.
I think the issue that I would like to deal with as a legislator would be that we need to make sure that the families themselves, whether it's adult caregivers to adult children or adult parents, whatever, we need to make sure that those caregivers are taken care of, both mentally, physically, and financially throughout the spectrum. And if that means we put a person on supplemental nutrition assistance or we give them expanded Medicaid assistance, whatever the case may be, I think what we need to do is we need to be focused on the caregiver themselves, and we need to be focused on the fact that there are going to be times when a person just does not have the ability to take care of it, another human being. And when that time comes, we do need to have the physicians and we need to have the nursing staff in place so that if somebody needs to make a phone call and say, I need help, we have somebody that can help them, because right now we don't have people that can help a lot of the families out there. And whether that's mental health services to just be a person to talk to or an actual doctor to see that their needs are met, I think that's what we need to be focused on. So as a legislator, that's where I would put my efforts, is making sure that the family is cared for from the very beginning. Thank you.
Montana has a high aging population. By 2030, we're going to see a 30% increase, or 30% of the population will be over 60. And from 2012, that's a 43% increase. And so if you look at that and the needs that our communities have, this has to be a priority in our legislature. It's called the gray tsunami or silver tsunami, that's what it is. But we aren't really preparing for it. We aren't looking at what we can do to support our caregivers and our families so that they can maintain themselves in their homes for as long as possible, and that the caregivers who are giving support can have access to affordable health care, but also to affordable respite care services so that when they need help, they can have a break or further community support. We need to make healthy communities, and this is a part of that. We need to make sure that our aging population is cared for and that the caregivers who are providing that care are given the support they need. We've talked about expanding Family Medical Leave Act. We need to ensure that that allows people to care for elderly family members for as long as they need to. We also need to ensure that there is quality, affordable home and community-based care. We just saw a lot of cuts through the special session and at the end of last session that have hurt those exact services. We need to fully look at those and what's most effective in our state and what we should be expanding, and no more cuts.
Shane Morjo, House District 95. I believe this is an essential service that we need to be funding in Montana. Representative Dudick hit on a lot of things that I actually was going to speak on. Affordable care, ensuring we have facilities that are affordable for our family members. I am grateful for organizations like Missoula Aging Services. I do think, I know they're not the absolute fixes, but looking at extended paid family leave, where family members can get their situation taken care of before going back to their job and being able to take care of their family. I've been fortunate not to have this problem, or not a problem, but this scenario in my life so far. But if it does, and when it does, when I have a family member that I'm going to need support on, I surely hope that the funding is there, and we have to, first off and foremost, we have to put back the money into the essential services that were cut last session. We have to start there, and moving forward, we can brainstorm. I'm fortunate to work with, you've heard all these individuals talk tonight. I'm fortunate to work with many of these representatives and senators and the candidates. I always learn something new from all of our candidates and representatives. I'm fortunate to work with them in the state legislature.
So I'm glad Shane mentioned the cuts during the special session. I think I would be remiss without talking about them myself here. I think we saw what occurred when a certain group of people and a certain group of legislators voted in a block to remove what would be considered, I think, essential services to a large sector of our poor, rural, and veterans community. And, people over the age of 65 are a large block of that group of people who are affected by that. The thing that I work in senior care, and, one thing that I think we talk about is not from a business perspective, but from a human perspective. The linchpin of senior care is really family care. And we all have a duty to take care of our elders. And we are all bound by that duty, and we know that. And we have all talked about this already, that the state not only, I think, has a role to play in taking, I think, I would argue, a bigger idea from the VA, who has really been kind of the leader in paying or making sure that, home and family members can be paid for the home care they provide to people who are eligible for VA benefits. There's places and there's other states that have done that and really been kind of the leaders there. There's a space for us to do the same. In doing so, not only would we enrich the lives of people who have been around for a long time, and also we'd be enriching the lives of the people who are taking care of them. And then also, most of the people who cannot avail themselves of professional services live in rural and underserved communities. So we'd also be enriching those communities. In my mind, it's a win-win.
Candidates, thank you so very much for listening to all of these questions and responding with such care. I especially want to thank those who shared very personal stories. I think what we're seeing here is that there are so many of us that are directly impacted by these issues as Montanans. The more that we can come together and have these really substantive conversations about really complex issues, we all benefit from that. So thank you, audience members, for coming. I also want to welcome you to step towards the mic, and please feel free to ask questions. Again, I ask you to keep them to be healthcare related and be questions that all candidates can answer. Candidates, given that our time is drawing to a close, if it's something that you agree with, please just refrain from holding your comments so we can hear more questions.
On behalf of the audience here, I want to thank you all for coming here. I know you probably had other things you wanted to be doing or could have been doing. And I also want to commend you for the high level of discussion. It's been very good here. I wanted to ask one of the questions, or a variation on one of the questions that was on the list that you didn't have time to get to. Montana ranks in the top 5 states in percentage of individuals age 65 or over. The fastest growing age group is over age 85, the so-called old. Considering Montana's aging demographic, how do you plan to address the challenges of our aging state? Thanks.
Did we just start?
Well, I'm probably closer to that age than most, excuse me. So it's coming up. I think the key is taxation. We have to review our taxation system in the state of Montana. We are trying to do many, many things, all of which are important and vital to healthy life. I was just in Utah for a brief time, and Utah's working on building a happy life. And I thought, wow, that's something we don't think about. I mean, we're scrambling to get services, and it's difficult. But I really think the core right now to provide the services that we're going to have to need, and as I say, I'm going to be needing it sooner than some of you, but it's a funding issue. And our current tax structure is just way out of whack.
Yes, I would agree. There's a money issue. That's the big one. But I think the key thing is that we need, the 150 folks that sit in Helena don't have the answers to everything. And I think it needs a lot of discussion between local communities, and especially those who provide the services right now. And again, I go back to where we see things here in Missoula and figure out how we get this done. I don't have all the answers, and I don't know if anybody here has all the answers. But again, it's a matter of we've got to put a plan together, something that's going to involve both the state and local communities.
Last year, I reached a magic point in my life, is that my home that I purchased and subsequently paid off the mortgage, now my taxes are the same as the mortgage and tax payments were when I paid for it, when I bought it. And which leads to the issue is property taxes have become astounding. We need to figure out a new way in which to fund education so much is not relied upon local taxpayers for special levies and so forth. Everybody wants to support schools, but it's becoming more and more difficult to vote these local levies. With better affordability, your seniors will be able to better stay in their homes and with a better look at property taxes. That's one way that we may be able to help.
You know, I'd have to agree. I think you can kind of break this question into two separate groups. There's the age 65 and over, and then age 85 and over. Age 65, I think we've seen that it's people living on a fixed income cannot tolerate ever-increasing property taxes, or they will have to move from their homes. And that's a choice that our society has to make about whether or not we're going to force people living on fixed incomes, largely everyone's parents and grandparents, to move out of the homes in which they were raised or raised their children. And that's, I think that shows the choices we have as a state to make with our tax system. Now, as it comes to people being over the age of 85, you know, I'm beating a dead horse here, but you have to have access to critical care hospitals. You have to have Medicaid expansion to maintain those hospitals. And there is no question there that people over the age of 85 will have better life outcomes if they have access to a hospital. We will lose access to those hospitals if we lose Medicaid expansion. And that's full stop.
I agree with a lot of the things my friends to my left have said. One of the things we haven't talked a lot about is where other places of revenue, where we can be tapping into revenue. Montana has multi-billion-dollar tourist industry, and individuals come from all around the world to Montana to use Montana roads and resources, which is great for our economy, but I think that's a lost revenue. I think the term that it was taxes turned into revenue enhancers last session, so I guess that's a nicer way of saying it. But I think that's something that we're missing out on, and we had proposals in the Democratic Party last session to find ways to tap into that. All those efforts were killed. So we are thinking outside the box on that front for those services. And affordable housing, I think, is another thing that's been touched on. We have to keep looking at ways to find affordable housing. Of course, filling the jobs in Montana and getting individuals into those jobs and them paying taxes is only going to help the overall budget of Montana. So I know it's an issue that we're going to have lots of discussions about, hopefully with me being there at the legislature, and I look forward to finding solutions to address this issue.
So I agree with everything that's been said, so I won't repeat that, but a few things that we've already talked about: caregiver assistance and the tax structure. As Representative Ryan especially talked about, we have to look at our tax structure. Over 55% right now is on the back of working people. We also have that aging population, so there's going to be less people working. So then that tax is going to go away, and that tax is either going to be increased on the people still working, or it'll be shifted to property taxes, which is already one of the high things. So I like the idea of people on a fixed income having some way to have property tax relief, but we need to make that easier. I mean, I don't know if anybody's ever tried to actually avail themselves of the property tax relief we have in the state. It's not really easy. I actually plan a bill to have a simple form probably sent out with the property tax statement that allows people to automatically protest their property tax increase. If the system is there, there's no reason it shouldn't be accessible and affordable and easy to use for people. So that's something that I'd like to see happen. And Something else we need to look at is, as far as shifting what we do tax-wise, we have many people buying property from out of state who are coming in here. They aren't working, they're retirees, so they aren't contributing through individual income tax, but they are making our tax rates go higher, but they have a lot of capital gains that they rely on for income. So if we're going to look at what we can do tax-wise to make our income to our state more equal, I think that's something else we need to look at, because those people are causing an increase in property taxes, but they aren't helping support our communities at all. We want vibrant communities, and we need to explore ways that elderly people, especially the extra elderly, I guess, would be able to have a meaningful way to interact in society and have a meaningful engagement in what they can do to be engaged in their community and to give back and to still be a vibrant part of the community fabric. So I'd like to see that explored in different ways also.
All right, I'd like to address this from a statistical standpoint. We are, as it says, one of the top 5 states in percentage of elderly people 65 or over. Fastest growing population, 85. To deal with the challenges of our aging state, the clear and simple answer is have more babies. But we can't do that as an aging population. So what we have to do is we have to bring in younger people. Right now, Montana sends out more younger people than we're bringing in. When they graduate from college, they're going to states that have opportunities for them in the tech industry or the manufacturing industry or other industries where they see their opportunities are outside of our state. So what we need to do is we need to retain those people. We need to bring more people in. Instead of sending our tech students to Colorado and California, we need to be bringing the tech people here. We need to be bringing the manufacturing people back into the state and their families, not just individuals who are single, but we need to be bringing families back in and offset the percentages of 65 or 85% or older. By doing that, we're also going to relieve some of the tax burden on the people who own homes and on those people who are on fixed incomes. So, short answer, have more babies. How we go about doing that, let's bring in more people that are going to be of the working age that can contribute to our communities.
Is this question to continue on down the table?
I think this will be our last question, so I think what we'll do is have everyone have an opportunity to respond or pass the mic if you don't have anything substantive to add.
Well, my response to this question is to look at really thoughtful and individualized solutions to be considered instead of a one-size-fits-all. This is a big shift in our culture of this aging demographic. You know, looking at things like helping people stay employed longer and paying taxes longer would be important, and then maybe phasing out with retirement plans, working half-time. You know, there's a great value in continuing to work. We don't all have to stop at 62 or 65. Keeping families in their homes with support by using services like technology and telemedicine. I mean, just thinking really out of the box about how to create creative living environments that allow for independence and support at lower costs. But I think the thing we all need to hear loud and clear is this demographic is going to be voting, and they most likely will be voting for Medicaid expansion. They're going to be caring about their Medicare benefits. And, you know, as elected officials, it's our obligation to address the needs of this demographic. And with support like Aging Services and other organizations, I'm very adamant about doing that. I'm entering it soon myself, and my mother's in that demographic. Oh, I know, one other thing too that's important to look at, a different medical model where there are more geriatric doctors available, maybe at a, I don't know how we encourage more. They don't get paid as much as the other guys or the other gals, but it's important that we look at that demographic's health needs in a different way than the general population. So thank you for letting me have a moment here.
I agree with just about everything that's been said, with the possible exception of encouraging an increase in the birth rate. But, it's good to hear all perspectives. I'm going to, instead of repeating some of the things that I already heard, I'm going to try to offer a different perspective from my city council experience. One thing that we did a lot of on the city council was reviewing subdivision proposals. And related to that, there's a tie-in here. A lot of people that I know that are entering their 60s or getting closer to, people want to downsize and have different kinds of housing options. People who lived out the 9 Mile, now they want to move downtown. And at the same time, first-time home buyers, young families, are having trouble finding something that they can afford to move into. And there are ways that the state subdivision laws affect what the builders build. Builders, of course, are going to build what they can sell for a good price at the time, but there might be some ways to incentivize different kinds of creative building. There's a lot to talk about there, and this isn't the time to go into it, but I just wanted to mention that diversity in housing types can be a big thing in one's life.
I don't have anything new to add, so I'll pass the mic fairly quickly here, but thank you for your question. Obviously, it's an important issue, it's a pressing issue, and it's something that we all need to work on, and so thank you for bringing it up.
Really quickly, we need to fill the cuts the legislature made to our vital health programs. We need to protect Medicaid and Medicare, and we need to create programs that ensure that people on fixed income aren't taxed out of their homes.
I know in California, I hate to bring up this word, California, but the people at a certain age are only taxed 1% of the value of their house. And it's a lot higher here. That would surely help. And Kim, your suggestion about capital gains, I'm against that.
Maybe I'll wrap this up a little bit. First of all, I want to thank all of the provider groups. I mean, this has been a hell of a hard year for all of us, whether you're in the legislature receiving these services or these agencies and the people who work in them. I want to really thank you all for showing up at all of those committee hearings, trying to find different solutions for these problems that we've got. And we know that the restoration is very partial that's come in. We're back to the 2016 base. We have not begun to repair the damage that was done by those cuts. So I want to thank you for sticking in with all of that and still trying to find ways to serve the people that we care so much about. This is an extremely complicated issue, as many of them are that we deal with legislatively. There are no simple soundbite solutions to it. There are many components and issues to it. The legislature continues to engage those throughout time, both in the regular session and in the interim. And I'm thrilled to see a whole new crew of people who are willing to come into the legislature with new ideas and experience to keep us moving forward in these areas. So thank you for sponsoring this forum and for your continued dedication to serving the people of Montana. And we hope that all of us who get elected and who are committed to these issues can help be partners, full partners with you in finding the way to really serve the people of Montana as we know they should be. Thank you.
You know how to close. On behalf of the American Cancer Society Cancer Action Network, the Montana Primary Care Association, and AARP Montana, we truly thank you for spending the evening with us, and thank you for your thoughtful your thoughtful responses, and most of all, thanks for running. It takes a lot of sacrifice to do that, and guts, and we really appreciate that. And we want to also remind you, we are nonpartisan organizations, and no matter who wins, we want to work with you on solutions. Before we wrap this up, let's have a special thanks to our moderator, Amy Casio.